Good morning, everyone. Thank you so much for joining us. I am Christy Wilbert, your Senior Vice President at URL Insurance Group. Also run the Medicare department here at URL. And today our webinar topic is going to be Medicare marketing. So Medicare 101 seminars or educational seminars, however you would like to call them. Today's webinar is going to be recorded. It will be available in our training library after an hour today, after it gets up and downloaded. There are other trainings out there for you to watch at your convenience. I would recommend you go out and check out the archive. There is one similar to today that I did with Karen McDaniel this time last year, and that goes over educational and sales seminars and the compliance involved in all of that. So today is not going to be that same type of webinar. Today, I actually have a special treat for you, and we have one of our agent partners here, Stephanie Yarbrough, and she is going to tell you about her experience doing them. She's been in insurance for a long time. She's done all different kinds of seminars, so I feel like you'll really appreciate the little tidbits that she's going to share with you today. But I will let her introduce herself. So go ahead, Stephanie.
Yeah, good morning. Happy to be here today. As Christy said, my name is Stephanie Yarbrough, and I have done seminars kind of on and off for the past 7-8 years. I've done them in different ways through the years, so I do feel like I've learned some things that might help you today with maybe mistakes I've made or things that I would do differently. Christy just asked me to kind of give an overview of what I have walked through with different types of seminars. So I have held them in public places. I've held them in my office. I have paid for mailings. I have tried to join with groups to hold the seminars. And I would say that some of the biggest challenges can be getting the people in the room. So I know we're going to walk through how that might look. But yeah, I've done them in many different ways, learned some things along the way. So we'll kind of unload that as we go here.
Yeah. And I know you've done 101s. You've worked with the carriers, like you said, to do carrier-specific sales seminars. So you've kind of been around the block with this. So I'm excited for everyone to learn the things that you've learned and even some of the mistakes. So don't be afraid to share those as well. We won't be judging you. You'll be saving them from doing the same ones.
Right.
All right, well, let's get started just quickly. What is an educational seminar? So educational is a Medicare 101. It is designed to teach people about Medicare in general. So it's not plan specific. It's not benefit specific. You're not going over Medicare Advantage plans or prescription drug plans or med sups. You're just teaching the person about timelines, when to prepare, what to compare, what A and B original Medicare covers you, why you need a drug plan, the whole process of what's involved in signing up for Medicare for the first time, because a lot of seniors really don't know what to expect. They're transitioning into a whole new world of healthcare, and they're looking for some guidance because it's not working like what they're used to on an individual or group plan that they have been doing for the majority of their life. So just a quick event do's and don'ts we're going to go over. Feel free to distribute any sort of material on information. There are a lot of things out there on cms.gov if you don't want to develop your own materials, but we always recommend if you have an opportunity to use your logo, use your name, and give it away, do that. Okay, so make sure that you're marketing yourself. That's the whole purpose of doing these things. You don't need to file it with CMS since it is educational. The carrier doesn't need to know about it, so you can do it whenever you want at your convenience. Answer questions posed by the attendees. That's important. You don't want to get into plan-specific things. Again, if somebody raises their hand and asks about their specific plan, maybe try to set up a different time to talk about that. You can hand out your business card or contact information. Again, we recommend that. Hold event in a public venue, and you can serve food. The great way to think about that, because I think a lot of us get confused on when can it be snacks and when can it be a meal. Just think of educational is not sales. So you cannot incentivize sales. So you can't incentivize by giving a meal. But since we're not doing sales here, you can provide a meal. And educational don'ts. We get the most questions about these probably, like, can you take an SOA? Can you put out a sign out sheet? Because you used to be able to put up a sign out sheet or sign in sheet, I'm sorry, but it was optional if they completed it or not. You can't do that anymore, unfortunately. You used to be able to collect scopes. You can't do that anymore at educational events. However, you can have permission to contacts available, which is really nice. And you're not allowed to hold a sales presentation under 12 hours after educational. You used to be able to do them back to back, and that was just a way to get people to attend both. But unfortunately, you can't do that anymore.
And I would add, Christy, of course, you're going to have your business cards available. And I also developed folders, like branded folders with all my contact information on the front, because those business cards can get lost pretty easily. And a folder they tend to hang on to, I've found, and they put all their materials in from the seminar, my name, my business information, my phone numbers on the front of that folder. So it's just another way to secure that information going home with them and hopefully have it available when they need you in the future, since it is a little bit more challenging now that we can't get the SOAs. And yeah, permissions to contact, definitely use those, because a lot of people will still fill those out.
Love that. Thank you. Yeah, anything you can hand out with your information on it, we absolutely recommend. A good one we've seen work too is a magnet with your photo on it and your phone number, because we have found that a lot of people actually of all ages keep magnets on their fridge. So it's a real easy reminder every day when you go to open your refrigerator, and a picture, of course, to remember the person, because people remember faces sometimes more than names.
Mm-hmm. Yep.
Okay, so how to best prepare. As Stephanie will tell you, you need to know what you're talking about before you stand up there and talk in a room full of people. Obviously, have that confidence. You're going to know more than they do, because this is all brand new to them, and hopefully you've taken the time to educate yourself. And that's all this slide is really about. It's make sure you've gone out on Medicare.gov and you've read. There's tons of articles out there that you can learn about. There's so many YouTube videos, our webinars we do, Medicare Learning Network. If you haven't subscribed to them already, it's free. So I recommend that you do subscribe to their newsletters. They have tons of training webinars that are out there for purchase, and they're not expensive. They're like $20 or $30. I personally do them just to see if anything's been changing or get any new nuggets of information that I can to share with all of you. So I would recommend subscribing to them. Really important to know your supporting programs, because you are going to get a lot of questions around original Medicare through Social Security. How do they bill? Who's billing for late enrollment penalties? How does that get adjusted? What are some Social Security questions that you've heard a lot, Stephanie?
Yeah, and I will address some of that in the beginning of the presentation, because if you might get Social Security questions that you're not prepared to answer, and I make it clear to them that even though they're going through Social Security to apply for Medicare, this is two separate entities. So I can answer some basic questions about Social Security, but if it gets into too much detail, that's not my domain. So just kind of set that expectation up front.
Yes.
And, I would just say, keep in mind, like, if you are newer to the industry and this feels intimidating, you know more than them for sure. I guarantee it. And you don't have to know every single thing. It's not wrong to say, I'll get back to you, but just presenting yourself as the expert. So a lot of this comes with just presenting with confidence and establishing yourself as the expert up front, because they're going to forget a lot of what you said anyway. But it's more of, this is who I want to call when I need Medicare. And it's building trust through the presentation. I like this person, because people want to work with people they like. So do they like you? Do they like how you presented? Do they like how you handled yourself? Do they feel like you're a trustworthy source. That's a lot of what this is about, even if you don't know every single question that's asked.
Absolutely. Yep. Important to know about low-income subsidies and extra help. So the Medicaid, how those levels work. We send out a Did You Know email here at URL once a week with little tidbits of information in it. A lot of them at the beginning of this year have been about Medicaid. So I recommend you go out to our website and check those out, because there are 4 different levels and a lot involved with Medicaid. So there's a lot of good education out there for you. Know your products. We all take the AHIP, so that's a really good base source of the difference between a MedSup and a Medicare Advantage plan and all of that good things. And I think those are the primary questions you're probably going to be asked, is the difference. And can you clearly explain the difference to an individual? Because I think it can get really muddy really fast. So practice, differentiating the two very clearly. And just educate the consumer. We don't see this very much anymore, but in the past, it has been very MedSup driven. People haven't really trusted Medicare Advantage plans, but they have come so far in the last 8 to 10 years. And it really makes sense at this point to be reviewing everything with the consumer and letting them make that choice, because everybody assesses risk differently. As you'll see, a husband and wife sitting down with both of them, one might take a MedSup and one might take an Advantage plan because they assess risk differently. And at the end of the day, it's all about what they feel comfortable with.
Yeah, I'm always giving equal time to MedSups and Med Advantage, because that's our job, to present the both options. It's certainly their decision, but it's the education of how each type of plan works. And it's important to bring equal time to both of those.
I'm so glad you said that. I knew you functioned that way, but it's just really nice to hear, because it is so important, because MedSup can get very expensive, quickly as you age as well. So if you're not telling somebody that they have another option, by the time they're 72 maybe and been paying for a MedSup for however many years, they might get frustrated if somebody brings up a Medicare Advantage plan for the first time and it wasn't you. It wasn't their agent.
Oh yeah, they're going to hear about it. You might as well let it be from you.
Exactly. Especially with all the commercials and confusion out there these days. Mm-hmm. That is actually a really good handout we have available to you. It's Medicare Scammers, and not that the carriers are scamming your clients by any means, but we have received a ton of phone calls this OEP about carriers reaching out to your clients and, doing phone conversations and phone appointments and switching them over to Medicare Advantage plans. Unfortunately, that is going to happen. It is a very competitive business, and different carriers are going to reach out to your clients. Different agents are going to reach out to your clients. So that's why it's so important that you're educating, you're that resource, you're providing all the information to them, so that when they get calls like that, they're not thinking about it for a second minute. They're like, no, I talked to Stephanie. She's informed me. I'm good. Thanks for the call. And we're moving on. It does happen. Even if you do everything right, you're still going to have clients that get swept away and take those policies. And, we could try to get you back on there. But it's always nice to leave them a little, something behind if this could potentially happen down the line, just to prepare them. So if it does, they know how to react. All right. So you've educated yourself. You feel good standing up in the room. First step, in my opinion, Stephanie could have a different one, is to pick your location. This is vital to attendance, right? So you want to pick a location that's easy, that's convenient, that would attract people to attend. We did a 63 plus focus group here at the office of individuals. We had, I think it was 17 people came in and just gave their opinion on how they first learned about Medicare, how they wished they would have first learned about Medicare. And many of them said that their employer did not do a good job at preparing them for that transition. And they wish they would have had somebody from their HR or even an outside source like an independent agent come in and provide, those details to them way ahead of time. And we do have some great agent partners that go into big employers and do presentations throughout the year for people that are turning 65 and coming off the group plan, just so they know their options. And that seems to be a really great way to get in front of a lot of people.
Yeah, I would say that is gold if you can get it, because your audience is already there. So we don't have the challenge of getting the people in the room. And if the HR manager is bringing you in as a credible source, you're already qualified in those employees' eyes. So I have found it challenging to get in the door with the HR managers. So it's something I would love to have more connections with. But yeah, if you can get in, it's a great source for presenting.
Yeah. Well, maybe we could do a second video on that, because here at URL, we have the opportunity to do Power Sales University. It's something you can sign up for if you're interested. Reach out after this, everybody, and I can hook you up with that. And they do a really cool whole module on getting past the gatekeeper of a business. And a lot of the times the gatekeeper are those HR individuals. So there's really cool tips in this training for that specific circumstance. Senior centers that offer independent living, it's more difficult to go to like an assisted living facility, but when they are in an independent living, there's usually a director that's involved of their monthly schedule, and they have to have so many events within their facility in a month's time. So really, if you work together, you're providing them a service. So kind of you scratch my back, I'll scratch yours type of situation, and getting in front of those people is less difficult. Other businesses with large client base, like financial advisors, law firms, P&C agencies, typically those types of organizations don't do health insurance or Medicare. Even big group health agencies, they don't focus on Medicare. They are worried about their large groups. So getting in a networking opportunity with organizations like that, where you could, again, help each other, sending referrals, is a great way to get business. And they usually have like a conference room or something like that, where you could use their space so their clients feel comfortable coming into their office, since that's the strong relationship. So that makes it nice. And then some neutral spots like diners. Everybody, again, wants some food or snacks. Libraries do really well because you can market within the library. Same thing with coffee shops or YWCAs or anything like that, where they have natural consumers, foot traffic coming into the building, where you can advertise right there at the spot.
So I'll speak to that one, Christy. I have done libraries before. I kind of ran the library circuit for a while. I had some libraries that actually would promote the seminar as a library event. It was hard. It was getting harder to find those as I was ending that period of time. But I find you can't just count on, what I found was that you cannot just count on the coordinator of the library events to publicize it enough, because it really depends who's sitting in that desk as far as how good a job they're doing. So it's great if you can actually get on the schedule as a library program. I feel like that's more challenging once they find out you actually do make money when you sell a policy. It's not so nonprofit-y looking, but you can rent a room in a library, and that is that's a comfortable place for most people to come to. It's a library, so they're not, intimidated by the venue, and it can just set it up as being an educational. So libraries are good. I have done restaurants before, and maybe I'll speak to the whole food thing at this spot. So I have done many things over the years. I, at one point, was going into restaurants and just trying to find if they had a back room or a back portion of the restaurant where people will come into, and we did like a dessert, coffee and pie kind of event. It's hard to find restaurants. I can't say that I prefer that type of venue, because then you have like people around you eating, and it's not always real quiet. It felt really kind of distracting. Unless they have like a separate room, that's fine. But if you can find a restaurant like that, again, it's not intimidating for people to come into a place like that and just have dessert and stuff. Last year, I actually did a dinner. So where the office space that I am is it's an event venue. So there's rooms here I can use. I actually did dinner. So I advertised a seminar, brought them in, fed them dinner, did the seminar. It got very expensive. And I don't know that I'll do meals again in the future, because I just felt like I put a lot of money out for the people that came in the door. And so I feel like if you're going to do food, maybe do a dessert or maybe a little, appetizer, something like that. It's nice for them, but be careful you're not putting too much money out in food.
Well, and Stephanie and I talked about this before we came on today, and we'll just reiterate our conversation a little bit. When you're doing seminars, it is a long game, right? Typically, you're getting in front of people that, they might be 64 years old. They're still working. So they might be thinking about taking Medicare when they turn 65, but continuing to work, and maybe deciding that they're going to stay on their group health insurance policy until they complete work, which might be 67. So you might be getting in front of a potential client 2.5 years before they're ready to use you. Mm-hmm. So it is an investment up front. Hopefully you get enough sales with your presentation that is paying for itself right away. But there's also the potential of getting more clients from that presentation, years down the line, if you're staying in front of them and doing the correct follow-up. But I definitely agree with her. Dinners can absolutely get expensive. But her time period's on point, because you can't always do breakfast. Those people, again, are working. So they're not going to not go to work in the morning and come to your Medicare 101 seminar. And those are the people that you want to get in front of. So dinner makes more sense because everybody's off work. They're more available. So I totally understand why you did that time of day.
Yeah. And I do usually offer a weeknight evening, because a lot of them are still working. So maybe a 6:30 time slot, but maybe just not a full meal, because you have to watch your finances too. Because like you said, this is a long-term game. I look at the people that came to the dinner seminars last year. I wrote business out of it for sure, but yes, a lot of those people don't need me yet, and they won't need me for a couple of years. So you do have to keep that in mind as you put out the investment. You have to keep in front of them afterwards, although, they'll forget you.
Exactly. It's all about your follow through. If you do all of this and you put in all the work and then you have no follow through, there was no point in any of it. Mm-hmm. And I just have that pro tip down there with relationships require nurturing to be successful. Networking and coming up with referrals with other businesses is so important. And please don't have the assumption that if you go out and you visit somebody one time and give them a tchotchke, that they're going to start sending you referrals. These are relationships that are going to need nurturing. You should stop in, drop off donuts, gift cards, bring them lunch, whatever you need to do to be in front of these people and create a relationship. It's not going to be a one and done sort of ordeal. So just setting expectations there. Okay, so you have the location picked out. Now we have to advertise the event, because even as Stephanie mentioned with the library, even if they post it somewhere, they may not put it anywhere else that's going to be helpful. So getting it out in front of people besides just the flyer and the sign-up sheet at the physical location is always great. A great way to do that are mailers. If you're working with another company, you could do email blasts to their current clients. There's radio advertising. There's social media invitation where you can actually pick out your target market and do a campaign, which we are going to have a whole webinar about how to social media market at the end of February. So sign up for that. We have a guest speaker who's a professional in that space, and I think it's really worthwhile to come on and listen. But going back to what Stephanie and I talked about is always market multiple dates and multiple times of day, because it is going to be a whole different market that you're reaching depending on what time of day you're presenting.
And I've tried Saturday mornings also. They're okay if the weather's cold. So once we get to the nice days,
That's funny. Good
once we
tip.
get to like the spring or summer, forget it. Like people are just outside. They don't want to come to a Medicare event on a Saturday. But in the winter, it's cold. There's nothing else to do. Those can go okay. Like maybe at 10 o'clock on a Saturday.
Mhm.
And I've tried weekday mornings. I've gotten less, it's usually a smaller crowd than the evening, but people have all different schedules. So it is important to mix it up.
Yep. It's funny you say that because we see the same thing here as an FMO. If we try to do an agent event on a Saturday, it's never attended. We have to do a weekday when you're not with your family or doing something else that's more important for you. So. All right, creating your presentation. This, like Stephanie said earlier, should be all about you. What makes you different? Because you click with one person doesn't mean you're going to click with another person, and that's completely okay. But we want that person to work with you because they like you, your authentic self, because that's the person they're going to get every day. So make sure that you're making your one-on-one presentations not only just be about Medicare, but about why a person's going to select you as their agent over all their other options that they have in this market. We have a director of compliance here at URL, Karen McDaniel. She'll happily look over and make sure everything is compliant for you. And our pro tip there is just to keep it simple. We actually had our keynote speaker at our conference this year, Deborah. She was amazing. She came in and went through like 400 slides in under an hour, just click, 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 going over fantastic little tidbits on how you can present a lot of information, very clean and concise. She did a phenomenal job on it, and I took away a lot of great information. But one of her key factors is that we can oversaturate somebody, and also that when we're putting information out there, often enough, we try to sound too professional. And most people are I don't know, did she say 3rd or 6th grade reading level, Stephanie? Do you remember?
Somewhere in there, I don't remember. But
yeah, like much lower grade than you would think. Because we can muddy the water if we are over wordy or, trying to sound too intelligent. So
yeah,
keep ourselves down.
For sure. And if you've been in the industry a long time, it's easy to throw up all this information on people, but these people, a lot of them coming in with no base knowledge at all. So you're going over, what is Medicare Part A? What is Medicare Part B? How does a Medicare Advantage plan work? How does a Medicare Supplement plan work? Timelines for enrollment. I don't get into the nitty gritty of the Part D deductible, and you just don't need to get that detailed. Again, what you want to do is give them enough information that they have a good concept of Medicare basics and setting you as the expert and someone they want to work with in the future. But you don't need to go over everything because you will lose them pretty. I can take a half an hour in. Probably a lot of people are done 45 minutes for we're pushing the max at that point.
Right. And if you go out to cms.gov, you can download a template Medicare 101 seminar, but it is 65 slides.
Yep.
And that is way too long. Like, Stephanie, do you know how long your presentation is? How many slides it is?
I probably have, and I keep switching it up too, but there might be 25, 30 slides in there. Oh my God.
Yeah. And you've worked with carriers when they're doing a sales slide. How many slides is it?
Yeah. Well, it's probably about the same.
Okay, good. Similar. Yeah. So keep it short. And these are just some notes for us, be attentive. You want to create some back and forth conversation, not lecture style. If somebody's raising their hand, we suggest going right for it, not waiting till the end for a Q&A. Be accurate. That goes back to just educating yourself. Be memorable. So be authentic, be you, maybe tell a joke if that's in your wheelhouse. Always have an action item. That's huge in sales in general. What's the point of everybody being there today, and what do you want to get out of them in the end? And be very clear about that. We are here for this goal. Outline your goals. Don't be afraid to ask for referrals. You're not going to get it if you don't ask for it. And identify your prospects in the room. It's fine in the very beginning to open up and say, who here is under 65? Who here is still planning to work after being 65? Who here is already on Medicare? Those are great opening questions to figure out your audience.
And I'll just speak a little bit into the Q&A. So I do control that to some degree with setting expectations in the beginning of the presentation about what kind of questions are appropriate for Q&A. So I make it clear that, even though I'm an independent broker licensed with many, many companies, that's not what today is about. So we're not, you can't ask me questions about any specific companies. This is general education. Those questions, I'd be happy to help you, but they're going to come during an individual conversation or an individual appointment. So that, that's not something we're going to address today. And then I'll also make it clear to them, like if your question is very specific to your situation, let's save those till after the presentation when I can talk to you individually. But if your question is more general in nature, you feel like it can help other people, by all means, please ask that, because otherwise you get people like asking like, well, it takes them like 5 minutes to ask their question about it's just not respectful to the other people in the audience. So those, I will control that. And I will break at certain parts in the presentation to allow Q&A. So I found that if I just keep it open, you can ask a question whenever you want to, they really disrupt the flow of the presentation, and they're asking me something that I'm about to get to in a slide or two. So like, hold on, like I'll do a segment. So maybe we went over, what is Medicare Part A and what is Medicare Part B. I'll do my full training, and then I will open up any more questions about that, these areas that I just went over before we move on to the next category. And it just helps them, it helps me not lose my place where I am. And I found that it's helpful to control the Q&A to some degree in that manner.
Yeah, great advice. See, that's why you're here today. So thank you. All right. So common mistakes. We did kind of go over, agents giving too much information. Their eyes are glazing over. They don't understand what we're talking about anymore. So don't make it so long. Most people are still working. So know your audience and cater to your audience. Not having takeaways. That's a huge mistake. How are they going to get in touch with you after you leave today? If we just showed up to give them a free seminar and no way to get in contact with you, that was a waste of your time and money. Lack of connection. So you want to make contact details very clear. If it was boring, be sure to interact with your audience and keep the high energy. Obviously, as Stephanie mentioned too, if you have a person that is disrupting, maybe they're talking about a grievance that they have with their carrier partner and it's inappropriate, be prepared to nip that.
Mm-hmm. Yep. Oh yeah. If they start bringing stuff up that's not helping the group, it's not constructive, they're complaining, I'll give them a respectful answer of my insight and then say, I'll move it on quickly. Like you take control of it and you just keep moving and, you just can't let them ramble on.
Yeah. Great advice. So these are just some interactive ideas to keep it less lecture-y, but scenario-based learning, everybody likes to hear a story or provide some sort of example, even if you're making it up, about somebody or a family member and what happened and how you brought value to it, or maybe just like a common misconception. Those are always nice. You can bring up, if you have a live slides you're doing and it's projected, maybe you could bring up Medicare Now and showing them the online tools that are available to them to quote themselves or educate themselves further after your presentation today. Trivia questions with Candy. As Stephanie said, she does like a segment and then breaks for Q&A. At that time, you could try to see what they've learned and, hand out Hershey Kisses, hand out Jolly Ranchers, hand out butterscotch suckers, whatever you think will just make it a little more interactive. And you can distribute surveys at the end, not about what they've learned, but how you've done and how to improve what you're providing. because it's always, people always like to give their opinions.
Mm-hmm. And if you're going to do the break with questions, that's also a good time to have them repeat back to you. Like you can go through all your slides, do the teaching, and then maybe the next slide is you ask. So if you're doing some kind of PowerPoint, you ask a couple key questions about what you just talked about, and then let them answer it just to enforce it in their head. What does Medicare Part A cover? What age does Medicare start? Whatever. Like you just ask your questions, and then it just gets them involved a little bit and reinforces the information in their head. And then you break for Q&A after that's complete. I found that helpful just to break up the monotony of me standing up there talking the whole time.
Oh yeah, for sure. And we talked about follow-up methods. So these are just some examples. We've been seeing more and more people using QR codes. So even to sign into Netflix on a different TV in your house, you get a QR code now on your screen. So, you put your camera up there, you push the button, it links you to a site. What we've been seeing is agents have been using it to link over to an intake form where somebody can put their name, address, and email to request the presentation. And then you'll get that email over to you at the office so you can go follow up later and send them a link to the presentation. And that way you're capturing their contact information. Offer a referral gift or promotions. So you just have to remember that referrals, if you're going to pay out anything or give gift cards, that you want to keep it under $15. And you also want to do it regardless of if it ends in a sale or not. So just because you're getting the contact is why you have to give the gift or promotion, not if it ends in a sale. Create tangible takeaway items. That's always nice. We talked about a magnet. People can make keychains, umbrellas, cups. We've done it all in the past. And you can also get things from carrier partners that they'll give you for free, which is nice to have there as well. And you still don't need to file with anybody. They're just takeaway items. And send follow-up emails to maintain engagement. So like we said, really important to stay in front of these people. Just because they're not a client today or a prospect today doesn't mean they won't be shortly or longly down the line. It just depends on their situation.
And Christy, I was just thinking through with the QR codes, like I give them a handout at the seminar because they like to take notes. Like they do have the presentation for the most part, but the QR code, maybe there's something else of value that you could offer them. Like I'm going to email you the Medicare New Book or something you've created, like a check sheet of common mistakes or a Q&A sheet or something, and still use that QR method because I like that to get their contact information. If they don't fill out that permission to contact, you really don't have their information. So I think that's a good idea. I was just thinking even through like, if I'm already handing them the presentation, maybe something else comes of value with the QR code.
Mm-hmm. Yeah, you could send out anything that you found valuable for sure.
Yeah. And then the emails. And I was saying this to Christy ahead of time, the biggest challenge of this, if they don't need you for a year or 2 or 3, you have to keep in front of them because as well as you might have done through the presentation, somebody else is going to get in front of them if you don't maintain that. So this is something that I need to get better at, honest, to be quite transparent. Like I need to be better at follow-up. I will call them, like within 2 or 3 days of attending the seminar, I will call them personally and thank them for attending. I will, again, offer any questions they might have that they did not get answered through the seminars, anything further I can help you with, and try to get a feel for their situation. Are they wanting employer insurance? What's their time frame like, so that I can kind of get them in my database appropriately. So that I'm good at. But yes, you have to maintain a constant stream of communication after that, or you might not get that lead in the future.
Mm-hmm. And if you're using a good CRM system, it should be really easy to pull like a list of names and addresses of people that you have in there as just leads, ones that you haven't closed on yet. And I would kind of put that in my schedule, just like I retain clients. Maybe 4 times a year, you're sending something to your clients for retention purposes, just to touch base. Try to do the same thing with leads. Maybe you're reaching out to them 2, 3, 4 times a year. Also, with a postcard, a client birthday card, with using send out cards, it's a really cheap way and convenient way to get those things out and not take up a lot of your time. Because you don't want to just keep doing email.
Yeah, because they'll go in spam too. They don't always see those. Yep.
Newsletters are great too. Even if it's sharing recipes or, something specific about a craft or a holiday or something about grandkids, as long as it's relevant to that demographic, I feel like it doesn't always have to be about Medicare specifically. It could just be something about something that they care about.
Yeah. Yeah, and they like to see your human side too. This is kind of a tangent, but I like with my clients, I will do an email newsletter regularly. And a couple weeks ago, I sent out like 2 pictures of my family from last year. I was thinking I never add anything personal with my clients. Oh my gosh, I had more response from that email.
Yeah.
Like beautiful. It just made me real to them, I think. And it was crazy the response I had from that. So, prospects, you have to be a little more careful, but don't be afraid to make yourself real to them too.
Right. And it creates conversation because, you have boys in college, maybe they have grandkids at the same college or their kids went to that college or they played that sport or like you said, it makes you real, creates conversation, and that creates stickiness. So you want to do that.
Yeah.
All right. Well, lastly, I just wanted to talk about our conference. It is going to be on a Wednesday this year at the Hershey Lodge, where we have it traditionally. It's September 3rd. It will be all day from 8 to 4 or 4:30, depends how long we go. I have not had confirmation that Social Security will be there yet again, but Frank is great at coming out and being there and showing his support. So I'm hoping he'll be able to get there again. We do have a keynote speaker already signed up. Her name is Shauna Thorson, and she is our Facebook marketing and advertising guru that she'll speak on our webinar at the end of this month. So really excited to have her at the conference this year. And then all of our carrier partners and you. So please feel free to register. I believe that's available on our website already. If not, save the date. Do we have any questions or last minute thoughts?
I was just going to say 2 things that I'm sure to hit on. The one misconception a lot of people have is that they have to be retired to go onto Medicare, and that's not true. So, of course, they just have to be 65. A lot of people think they can't have an employer insurance option. So I will make that clear during this seminar, because that's where a lot of these people coming, that's where they're at. They're working, they're turning 65 soon. And I will always offer that, comparison of employer insurance to Medicare, because many times it is better to move on to Medicare, even though they have an employer insurance option. Of course, there's lots of, things you have to consider there, but that I will make clear during the seminar, because that can pull people in sooner than later sometimes as clients.
I agree. So we do have a few questions out here. One is to clarify, permission to contact is okay. Yes, that is correct. Medicare Learning Network on CMS, it is linked from CMS, but it is its own website that you will register and log into directly. How can we connect with Karen McDaniel? She works here at the office. Her extension is 117, or her email is karenem@urlinsgroup.com. Or you can just contact me as well. And then Cassie said, Stephanie, what are your tips for getting people in the door? Because you did say that was your hardest part.
Yeah. So if you're not going to be in a group that the audience is already established, and then you're responsible to get the people there, I like direct mail. So targeting, that age range that you want to have at your seminar with a direct mail service, that I found is the most efficient. I have actually not tried Facebook, so you can see how you do with that. And it sounds like we're having a training coming up, but I use direct mail if I have to get people in the door.
And just to be clear, for those of you that don't know what she means by that, is she'll use a lead service like Lead Connection or Concepts or Target Market or whatever, and you pay for the demographics. So you pick the age range you want to do. I mean, you can narrow it down to zip code, county, specific areas, income levels, and you just pay for their names and addresses. So I believe it's around like $75 for 1,000. I don't know what the going rate is, but that was the last time I checked. So very inexpensive way to attempt to do a mailer. And most of those places, they are a mailing service. So they'll even send out what you've designed or what they've designed at a cheaper, cost than regular postage because they're doing it in mass.
Yeah, and you have to figure out your geographics as far as how far of a radius do you go out from your location. I think I generally go like 10 miles, but you have to see how many people are in that area where you are, because you might have to go out further than that to get enough people to mail. If you're in a more densely populated area, maybe you don't need to go out that far, because people don't really want to drive more than a half an hour is probably pushing it, really.
I would agree with that.
Keep it under that if you can.
And then we have another question. Are there different factors to consider when presenting for one-on-one versus a group?
Yeah, and I would say, go ahead.
No, you go.
A group, like if you got in the door at an HR, with the HR. So if you're in an employer setting, as far as different factors to consider, I consider that I need to keep it very brief. If I'm like coming in for a lunch and learn, these employees are on the clock. They only have, and I don't mind if they eat lunch while I'm sitting there. Fine. I mean, while I'm talking, they can eat lunch. No problem. I'd be very respectful of the employer's time that they're allowing their employees to attend. So I will make it even more brief if I'm going into an employer group setting, as opposed to if I'm bringing the people in the door, I feel like I'm more lenient with how long I go. Was that the question? Groups versus?
Yeah, I think, or to your exact point, you said brief and basic. When you're with a group, you're generalizing because you don't know each person's situation. But when you're sitting on a one-on-one, you're very specific on their wants and needs. You know exactly what they're looking for and how to cater the conversation around them.
Right. Yeah.
Yeah. And you're probably doing a sales presentation at that point. If it's just one person, you're doing an appointment.
Right. Yeah. I mean, if you just have to know the group that you're speaking to. So if it's if you're going into an employer, maybe if you can get any kind of heads up on what their employer insurance options look like ahead of time and kind of speak to that a little bit, if they allow it, it helps the employees start thinking in their head, oh, we do have a $3,000 deductible on our plan. Medicare, we get that down to $257. So maybe I should have a conversation with this lady. Just that point alone, can drive it home to help them understand that they might want to compare. If they're over 65, of course.
Right.
But,
and if they're under 20 employees, technically they're supposed to be picking up their B because Medicare is primary. So if you're picking up your B and you're already paying that premium to original Medicare, I don't see a point in continuing to stay on your group plan. You're already paying the most expensive part of Medicare. So just go on a Medicare plan at that point, because typically the coverage is going to be better unless you have a situation with prescription drugs that's different or whatever. But that's a one-on-one situation that you're going to have to figure out with the person. Right.
Yep. You definitely, and are other people on the employer, you always have to ask the questions. Do you have a spouse on the employer plan? Do you have dependents on the employer plan? Like, of course, it's not a cut and dry answer, but it's worth having the conversation because a lot of people don't realize it's even an option for them to still be working full time and going Medicare. They're just moving their health insurance. And let me tell you, the employers never mind. I mean, they're always pleased if an employee is leaving their plan because it's generally costing them a lot of money.
Right.
To give that employee on their insurance plan.
Right. And typically the spouse, they're not being covered by the employer at all. Typically you're paying 100% of the spouse, unless you're like government or, union type situation. But you can come off the group and still have the spouse be on COBRA and pay for them under the same plan. So there's a ton of options. You need to review with the professional and go over the person's specific situation for sure. All right. I think we had one more question just about the the lead organizations again, we do have a whole page of them on our website. If you go under Medicare and then lead organizations, they're all listed there. I did name a few earlier, but you can use whoever you want. They all do technically the same thing at the end of the day. They're outsourcing, pulling lists of information. So we like using the ones we have listed there because they're tried and true for us. We've used those for years. The good turnaround time, good return on investment. So you can use whoever you want. All right. Well, thanks, Stephanie. I think that was fantastic. I appreciate all of your input and your time today. And thanks to everybody who came out and joined us.
Thank you.
Bye.